and with the best dose to get the maximum of results. So we can inject the frontal area.
Okay.
We can inject the periocular area.
Okay.
And there's a popular procedure now of eyebrow lifting.
Eyebrow lifting, yes, yes.
In the field, if you're going to touch on the latest thing in plastic surgery, we have like the medical rhinoplasty.
Rhinoplasty is very common, isn't it?
But we are probably talking about like surgical rhinoplasty. Now we are talking about medical rhinoplasty. We can modify the shape of the nose medically without the using of plates, by filling the nose.
Really?
Yeah, and like changing the the projection and the rotation of the tip,
the tip
by using the buttocks again.
Amazing.
So this is like if you have like a well-trained physician surgeon, so he will be familiar with the anatomy of the face and all the muscles of the face and the nose, for example. So you will know exactly which muscle to inject in. And it will change the rotation and the projection, for example, of the tip without the need for an open procedure or an open rhinoplasty, for example. We can inject around the mouth to eat the wrinkles around the mouth, and then to augment this with fillers.
So usually for thinning lips, I believe. Yeah. Okay.
And then you see those big wrinkles here, or bigger, like it's called like platysmal pans.
Okay.
That's usually start after 50. So we have to inject it with a special amount of buttocks in special areas, so to avoid complication like dysphonia or dysphagia, for example. And then we have like a type of lifting. It's called Nefertiti lift. I'm not sure if you have heard about it.
I've heard about it.
Yeah, so it's mainly like we can inject around the mid-lower part of the face to get like lifting without the need of surgery.
So this happens when you're 50?
More or less, yeah.
Okay, so we're safe for the time being.
Oh, yes,
we're safe for the time being. Now, of course, a very important question I'd like to ask you, Doctor, is that what type of plastic surgery do you have or do you see here in the Arab world more often?
The most common procedures are like liposuction and body contouring surgery, whether it's abdominoplasty or the treatment of massive weight loss, the consequences after massive weight losses. That includes brachioplasty, body lift procedures.
Okay.
Now the fillers as well. Fillers like is worldwide, not only in the Arab world.
Amazing.
Like being a Saudi, and so I'm quite familiar with the Saudi patients. That we are the first thing they ask me. Yeah, so fillers and botox are the most popular.
Interesting.
Other facial rejuvenation surgery like rhinoplasty, facelift, whether surgical or non-surgical. Now we are able to lift the face with threads. Without the need.
With threads, yes.
Yeah,
yes. I've seen it. I've seen that before.
The latest innovation, like I recently returned from a trip in Monte Carlo, where I shared like a session about like the use of stem cells.
Stem cells, okay, yes.
In the face and in the breast, where you can, and we started this technology here recently in our centers in Riyadh. And this will give like the best rejuvenation of the face, where you will be able to, for example, using stem cells from your own body, and to re-inject it in the face. And probably you can have a combination between stem cells and fat. And the problem, because like if you would ask about the fat, because the fat is the best natural filler.
Fillers, of course.
But the problem that you have a higher resorption rate compared to like if you over time. Like in the first 6 months, you have like around 30–50% of the fat being resolved. Like I did a French study about analyzing 200 different articles that was studying like the rate of resorption of fat. So the problem with the fat is like the resorption of the fat. But if you combine it with like latest rich plasma that promotes stem cell proliferation, that will lead to like a longer duration of fat survival in the body. So that's it's actually present here in Saudi Arabia, and we are very proud that to offer this kind of treatment to our Saudi and expatriate.
Wonderful, wonderful. So, doctor, once more, can you tell us about the harms of the plastic surgery in general, like different kind of harms of plastic surgery?
Once again, thank you very much for this question. It's very important, like, to understand, like, the complications before heading to surgery.
Of course.
And the most common complication are the complication related to the most common procedures, which are fillers.
Fillers, okay.
So now we're using like mainly like resorbable materials. As I mentioned before, it's hyaluronic acid. Hyaluronic acid is actually the material that's between the cells. It's the connective tissue. It's not, so it's actually a natural component.
Okay.
And it's based on on the chemical composition on NASHA, which is non-animal stabilized hyaluronic acid. So it has there's no allergic reaction if you're gonna inject it in the. But the problem comes from like using non-resorbable materials. Like yesterday, I saw like 4 patients being injected with non-resorbable materials. They have very bad complications. They can start with necrosis of the face. They can start with infection. Luckily, they were not mine, but were treated elsewhere. But we have to take care of these patients. Still, they are our patients and have to be treated. But the thing is, you have to use resorbable material and natural material.
And natural, of course.
Fat injection, it's very safe. Other harms or other complication is unrealistic expectation.
Okay. This is
unrealistic
very
expectation, like people coming to a surgeon or reconstructive or plastic surgeon, like with a photo of
someone famous, and they want the same results.
It's quite unrealistic. So probably you would know that your result would be unrealistic as well, because they're starting with a realistic expectation from the start. Thirdly, the psychological disorders, like people, whether it's man or woman, because like we have a lot of men now doing plastic surgery. Like around 30 to 40% of our patients are male. So they are coming, we're having like psychological disorders, and they have this belief like once they have like a physical defect being treated, so their psychological problem as well is gonna be improved.
As well, exactly. Now,
But they would be surprised after the operation, even if even if the result is perfect, that nothing has changed.
Wow.
So they will come back and they will start like complaining. Nothing has changed. This is not. Although that you have like a perfect result on the all the standards and from all the but they are not satisfied. So that depends on like the patient itself. I mean, you have to be realistic. You have, if there's any psychological disorder, they have to be treated first. That's before.
That's important.
Other complications related to plastic surgery is probably related to other operations. Probably it's infection or lower or a small amount of bleeding. But in the field of plastic surgery, it's probably less than 0.5% of all the operations. So there's it's not, if it's done well, so probably nothing.
That's interesting. And of course, Dr. Mohammed, so we're running out of time. 2 important questions I want to ask you. First important question would be, can you give us a brief idea about the latest technology being used in the medical field for plastic surgery? And my second question, sir, could you give us some advice or some tips for our viewers who are planning to undergo plastic surgery? What are the things they need to know, and what are the things that they should be aware of?
The newest technologies are non-surgical rejuvenation of the face and body parts using like threads, fillers, different complements, non-surgical augmentation of the breast, buttocks, and without the need of surgery. The medical rhinoplasty is then probably state-of-the-art subspecialty now in the treatment of facial rejuvenation. This is probably the newest thing regarding the surgical aspect. The use of tissue engineering and stem cell transplantation. As we started this recently in Saudi Arabia and Riyadh, and it's very the results are very satisfying for the patient, because you're having something from their own and being so nothing.
It's natural.
It's very natural.
No reactions to that.
And the second question regarding like the tips and the advice. First, you have to be realistic. You have to start with. You have to be realistic with your idea about what you want to be done for you.
Exactly.
You know? And the second thing is to go to a well-trained and physician and professional doctor that has a very good reputation among the different healthcare workers.
Absolutely agree. With this, thank you so much, Dr. Mohammed, for joining us.
Thank you very much.
And of course, that was Dr.Mohammed.alnasir, who's coming to us from, of course, the Saudi British Hospital. And as he said, there are many things going on in the field of plastic surgery. But before you have any procedure, do your homework, and more importantly, do not be afraid to ask your doctor. And of course, that was Dr. Mohammed.alnasir, who's coming to us from, of course, the Saudi British Hospital. And as he said, there are many things going on in the field of plastic surgery, but before you have any procedure, do your homework, and more importantly, do not be afraid to ask your doctor or your surgeon any question at all. We'll be going on a short report about plastic surgery. We're going to go all the way to Paris. Do stay tuned. We'll be coming back here in the studio, joined with yet another special guest.